Hi, I'm Dr. Christopher Mote of Cornerstone Health Community, and today I want to talk to you about fibromyalgia syndrome. Syndromes in medical speak are conditions that don't have diagnosable lab markers, but rather are put together and put under the heading of a label like fibromyalgia based on symptoms. And this is the perfect example. Fibromyalgia syndrome, of which 4 to 6 million people in our United States suffer from the painful condition, has as its cause several things, but it's recognized by these symptoms: pain in the ligaments, muscles, joints, and specifically, if we're going to really split hairs, there are tender points that people have that can be found on most people's body. But if you take the pain plus depression, fatigue, headaches, and any number of these other symptoms, and you put them together, you have fibromyalgia based on these symptoms. And so the standard medical approach is to take medications for the pain and or the mood and depression. There are 3 that are FDA approved: Cymbalta, Savella, and Lyrica. All of them have side effects. At Cornerstone Health Community, we take the approach to look for the root cause and the things that would be contributing to these symptoms, irrespective of the label. So we're looking at these key multifactorial points. First of all, our fibromyalgia patients all have nutritional deficits, whether it's magnesium, it's B vitamins, it's fish oil. So rather than guess and give them a smorgasbord of supplements, we run an organic acids test. It's a blood and urine test looking for the actual deficits. So we take only the targeted nutrients that we need to fill in the potholes. After we've done that, then we make sure that our patients get great sleep. Unless you wake feeling refreshed and restored, your sleep is not able to remove toxins, put down inflammation, and repair tissues. So that's one of the first things we have to put on board. And so for a fair number of patients, even those that don't have big necks or are not overweight or snore, they have sleep apnea. And we can get an at-home sleep test for those patients to make sure that's not the case. And then we have inflammation. It was long ago thought that it was not an inflammatory condition because blood markers like CRP were not elevated, but clearly inflammation drives fibromyalgia. And from the diet, we have 3 prime sources. We have alcohol, which everybody knows about, gluten, which most people know about, and then we have glyphosate. Glyphosate is the active ingredient in the most prolific herbicide spread on all the crops in the United States that are not labeled organic. And we have to avoid it if we want to get over fibromyalgia. So we have our nutrition therapists sit down and lay out meal plans and shopping lists and recipes so we can avoid these 3 inflammatory foods in the diet. And then there's biotoxins. Biotoxins include mycotoxins made from mold, which mold will stay in the mucous tissues of the body, the intestine, the nasal passages, but the mycotoxins they produce go everywhere in the body. And so they will circulate, and especially painful are the previously injured areas of the body. If you twisted an ankle, if you had a surgery, those are going to hurt when you have mycotoxins circulating. And then we have bacteria that produce toxins like lipopolysaccharide or LPS. And so between bacterial and fungal toxins that circulate through the body, inflammation, pain, mood changes, all of the symptoms of fibromyalgia are going to occur. And so rather than looking for a medication or a one quick fix, if we look at each of these and address them as we find them, we can not only reduce the symptoms, eliminate the symptoms, but put our patients who have fibromyalgia in remission.